Okay, next we're going to look at the spinal reflexes of the thoracic limb. These reflexes go through C6 to T2 spinal cord segments and nerve roots. And if there is a large lesion in this area, the spinal reflexes will be depressed or absent. And we're also going to be looking for crossed extensor reflex, which indicates that there is a lesion above the level of C6 someplace. So we'll start out and get the limb to relax, and I use my fingers, my thumb and my index finger, on the tendons of the biceps and triceps. And I'm going to take the flat part of my hammer and I'm going to hit my thumb, and this is about all you see, just a little bit of reflex there associated with that. It's not a real large reflex response that we get on these dogs. And this is the extensor carpi radialis muscle. You can see just a little bit of movement we get there when we tap the flat part of our hammer on the extensor carpi muscle. Now, the most reliable reflex of the thoracic limbs is the flexor reflex. It's also called toe pincher withdrawal, and that's all there is to it. You just actually touch the paw and see them flex their limb. Now, it's good to do the leg she's lying on, because if she has an crossed extension reflex, then we can see it easier. So we're going to see that, and this, if she had a crossed extensor reflex, she would go into rigid extension like this. And this is most often due to a lesion above the level of C6, anywhere all the way up to the brain. So that's an important reflex to do. Now we're going to evaluate the spinal reflexes of the pelvic limbs. And we want to cradle the leg in our hand like this, so it's very relaxed, because they can inhibit all these reflexes if they're tense. And the first one we're going to do is the patellar reflex, which is L4-5. And so this is, of course, the patellar tendon, and we're going to take the flat part of our pleximeter and tap the tendon. You can see that's an easy reflex to get. Just about everybody can get that. If it's depressed or absent, that means there's a lesion at the L4-5 segment somewhere in the segment or the peripheral nerves going to that. Next, we'll do the cranial tibial muscle reflex. Well, gastroc and cranial tibial. We'll start with the gastroc, and we'll just put our thumb on the gastroc muscle. They have to be pretty relaxed to get this, but you can see by tapping our thumb, we get the response. This is the cranial tibial muscle. With the flat part of our hammer, we directly hit the muscle. And then this is the sciatic notch, so very well muscled here. And we can either put our index finger or our thumb and tap that and get the sciatic nerve reflex. All of these go through L6 to S2. And if there is a lesion there, then we will have a depressed or absent reflex. Again, the most reliable reflex on the pelvic limb is this flexor withdrawal reflex. So we just give a little light pinch of the toe, not enough to excite the dog so that the pain travels up to the brain, but just enough to get the reflex. And this is only a reflex. This does not mean that she feels this. It only means that L6 to S2 spinal segments and nerve roots and peripheral nerves are all okay. She could have a severed spinal cord up here and still have this reflex. So this is not perception of pain. I make a big deal of that because a lot of veterinarians get that confused. Then we're also going to look for the crossed extensor reflex on the pelvic limb. So as we pinch this, see how she was trying to get up? It looks like it extended, but it didn't. Thank you. That was perfect, because that's a common mistake a lot of people make. They will get a little increased tone, but it shouldn't extend all the way. Now she's responding because she's feeling it, and that's the deep pain response, which we'll talk about in a minute. So that again is L6 to S2 as well. And if the crossed extensor reflex is there, that means that there is a lesion above the level of that reflex arc, or above L6. So the last reflex that we're going to look at is the anal reflex. Now you can do rectal palpation and get a feeling for anal tone, but lots of times if you just lift the tail and poke around here in the perianal region, you see she responds to it, as well as has a local contraction. She'll pull her tail down too. That's also part of the reflex. So that pretty much does it. That's S1, 2, 3, and that pretty much does it for the spinal reflexes.